You're a runner. You've been running, everything is going good, and when you get to the 5th or the 8th mile, boom, sharp stabbing pain right here on the side of your knee. You have heard about IT band syndrome before, so you start rolling with the femoral, torturing yourself, and you take some rest, then you go back running, and the pain comes back. Well, let me tell you what nobody has told you before. Rolling the IT band is not going to fix it, and I'm going to tell you why. My name is Dr. Kevin Tomassini. I'm a doctor of chiropractic, I'm a health coach, and a track and field athlete. And today we're going to go over IT band syndrome. First, we need to understand what's the IT band. Well, the IT band is not a muscle itself. It's a band of connective tissue. It starts on the iliac crest, goes here to the tensor fascial, that's a muscle, and then goes to the knee and inserts right here on the lateral tibial plateau. Below the IT band, there's a bursa and a fat pad. And with overuse, there's going to be some friction, and that will cause inflammation and pain. Now, the problem is not right there on the knee. The problem is actually on the pelvis, and it might be on your foot as well. It's an alignment problem. It's a movement change. If there's a problem in one of those areas, it might reflect on your knee. Now, one of the most common conditions is misalignments of the pelvis. When the pelvis is misaligned, your knee is going to collapse in, and that's going to put pressure and tension on that area. If your foot arch is dropping, you're having foot pronation, that might put the foot and the knee in that same position. That might cause inflammation there. And if you're running on an uneven surface and your knee is collapsing in, that is going to stretch that area and put some tension and on the fascia, and then pressure right there on the bursa, and that will lead to inflammation. So to fix the IT band is not just rolling and torturing yourself with that femoral, is an alignment problem, and you have to fix the alignment and the muscle imbalances. One of the most common imbalances is weak glute medius, weak adduction, abductor muscles. Abductors is going out, adduction is going in. So every time you're running, your knee is going in, so it's adducting. We need to strengthen the glutes to hold a good position and prevent that excessive adduction from coming in. So you need to do fire hydrants, you need to do glute bridges, and I will go over those exercises later on. Now, the foot, if your foot is collapsing in, every time you're running, the knee is coming in, so more strain. So what to do? Well, you have to improve your arch of the foot. That can be done with exercise. If it doesn't happen because you have a pretty flat foot, then you might need some orthotics. And always check your shoes. If you're running a lot, you have to change your shoes every 6 months maximum, because you start to lose the medial support of the arch and your foot will collapse. Now, simple exercise that you can do at home. I'm actually at home as well. That's why I have all this mess behind me, and I have my congas here. I wish I could take my congas to work, but I can't. That will be too much noise. So the first one is going to be clamps. Clamps, you're going to lay down on your side and you're going to open your legs like a clamp right there. Okay, and put your arms like this or whatever, however you're more comfortable. The main thing is that you're using that gluteus medius to abduct your hip. I usually do 15 reps, 3 sets of 15 reps till I feel that burn right there. And I like to go like this as well, but the main one is going up like that. The next one is going to be glute bridges. You can put a ball here or a band around the knees, and you're going to go up, squeeze the glutes. Imagine that you have a grape in between your butt cheeks and you're just squeezing that grape, and then go down. Another variation is doing it with one leg, and this is better. This is a little bit more difficult to do. Put one leg up and then go, squeeze that glute, and then go down. You can do reps like that, or you can hold for at least 5 to 3 seconds. 3, 2, 1, and then go down. 3, 2, 1, and then go down. Do some sets and reps for that. I usually like to keep my sets between 3 to 5, and I do 6 to 10 repetitions of that. And another one that I like to do as well is fire hydrants. Imagine you're a dog and you want to pee on a fire hydrant, and you just go like that. Pretty good exercise. It's almost like doing clamps. And I like to do my kickbacks as well. That's all working on your glutes. Another exercise that I like to do to prevent my knee from going into adduction, especially when running, is lunges. Whenever you're lunging, make sure that your knee is not collapsing in. You want that knee to stay neutral, to stay pointing forward. You can do that with a band, putting tension that way, pulling your knee in, so you are engaging more the glute and the lateral side of your tights to keep that. And you can do as well some gobble squats, going down on a squat, preventing your knees from going in. And the other one will be to put a band between your knees and walk like a crab, side to side, side to side. That's a pretty good exercise, and you will feel it definitely on your gluteus medius muscle. Now, for chiropractic adjustments, I'm going to focus on adjusting the pelvis, adjusting the knee, the ankle, and the foot. And I'm going to do ART on the TFL, the tensor fascial lat muscle, on the glutes, and on the side of the leg right here of the thigh, on the fascia itself, and on the quads, to release those muscles and that fascia. Now, when to see a professional? Well, if you have been doing all the exercise and all the recommendations, and in 4 weeks this is not getting better, well, see a professional. We might have to rule out other conditions. It might be an injury on the lateral collateral ligament. It might be a lateral meniscus injury, or it might be a stress fracture on the fibula. Really important to rule out with imaging. We can take some x-rays or some MRIs. So if you're a runner and you're having lateral knee pain and you're just rolling and rolling and rolling and rolling, and the pain keeps coming back, now you know that the pain is coming from your pelvis or from your feet. Follow this protocol, and if you want more tips, subscribe to our channel. Again, this is Dr. Kevin Tomassini. Let me take you from pain to peak performance.